The theme this year is about taking the strategy that was launched last year and making it really become action. So it's turning the strategy into action and achieving those changes we need so much.
This conference brings together everyone whose aim is to make the United Kingdom the envy of the world as to how we look after our eyesight, we access the best services and ensure a fully participative society.
Well, it's been really exciting morning. So we've had Anne Mcguire speaking to us, and I believe Anne is the darling of our sector.
I remember once being told by a woman who had lost her sight, "I'm not sick, Anne. You can't write a prescription to restore my sight, but you can knock down the barriers that make life more difficult for me than it ought to be." And I do think that is the powerful message that we need to listen to.
And then we had Dr. Mike Bewick launching the NHS call for action on sight loss issues, which is so great. It really, really builds on the announcement last year of sight loss becoming a public health indicator. So not only are we going to be counting the numbers of people that potentially might lose their sight, but we're now going to have a call to action so we know what to do about it.
There is no better place to launch this than here today, with so many of you here interested in this particular area and many of you affected by it. And it's your voice that we need to hear.
This is delightful to realise that NHS England now recognises eye health as one of the key primary care services.
Optometrists are central to the delivery of good healthcare, particularly preventable eye disease. I think they must be very frustrated that often they have to go through a whole bureaucratic system to get the patient to the point of need in terms of their required treatments. So I think we should be looking at much more integrated and innovative solutions so that that optometrists, who is a professional in their own right, often highly skilled, and ends up having to use either a GP or other service to deliver. We should be looking at what can be delivered locally in that surgery by the optometrist, but also how we streamline the referral, if it's needed, to hospital and beyond, because they're the people that know, and I think that we must utilise their skills more fully.
For me, today really is about focusing on what difference are we all going to make. And I think the people in the audience today, but in the sector more widely, need to take responsibility for changing the environment for blind and partially sighted people and those who are at risk of losing their sight.
The key message I always say to me is the key one, that we will only get the changes we need if we really work together, we listen to each other, we respect each other, and we actually make sure we have the same messages working together, because that's the way to achieve change.
Wouldn't it be great if we could just sit back and say, well, job done. The UK is the best place in the world for people that need treatment for a sight loss condition or need support because they are a blind or partially sighted person. But I don't think that's going to be the case. I think the issues will have moved on in the next 2, 3, 4 years. But I think what's really important is that we continue to talk with blind and partially sighted people and patients of optometrists or people in eye clinics to find out what are the current priorities so that the strategy remains really relevant to the here and now and the needs of blind and partially sighted people in particular.